Welcome back, everyone. My next guest has been on with me several times. As a matter of fact, for years. I have with me Howard Farkash. Howard, I want you to tell everybody first a little bit about yourself, real quickly, and what we're going to talk about today.
Well, good afternoon to you, Carol, and to our audience. Good afternoon indeed. I'm Howard Farkash, a native of Chicago, living here in the Valley since about 1997, 1998, at which time I came out here to assist my parents in their retirement, address their medical needs, etc., and kind of liked it a whole lot, so I decided to stay and found myself working with other seniors other than my parents, basically. So what I do basically is I run an agency that specializes on Medicare type of health financing, and we also look at care beyond Medicare in a project called, well, it's called Care Beyond Medicare, but it focuses on long-term care because sometimes we do need additional care. Medicare does not cover everything. And today I'd like to focus on the review process because we are in the review part of the year.
It's senior season.
It's senior season, Medicare season no less. And during that time, it's an opportunity for people to review their medical plans. Now, you might be wondering, why should people review their plans? Especially if they took a long time figuring out which plan to get onto to start out with. Well, a lot of the plans change. There's three types of plans out there that need consideration. Medicare supplements don't change. They stay the same year after year after year after year. The only thing that changes is the premium. But Medicare Advantage plans and prescription drug plans do change. They make serious changes, and sometimes, especially in this year, those changes can be meaningful from a price and an economical perspective, basically.
Well, it's a free service to them out there, and it just makes sense, especially this year, correct?
Oh, that's what we do. Our service does not cost people anything at all. What we do basically is take a look at, well, let's take a look at one of the two types where there's a lot of change, Medicare Advantage and Medicare prescription drugs. Let's look specifically at the prescription drug part of things, basically. What can happen with these plans are only good year to year to year, and the companies have the option of changing them on a year-by-year basis. Sometimes they drop a plan completely, and then you're virtually forced into changing or switching your plan. Other plans, other plans just make changes to the formulary. In other words, what drugs are covered. Sometimes drugs are dropped off the formulary. You don't want to find out that one of your drugs has been dropped off formulary because then you'll be paying full retail for that prescription. But they also re-tier drugs, so it may have been a tier 1 drug with a low copay becomes a tier 3 drug with a much higher copay. So that's important. That's another thing that the companies do. They also change the premium for the plan. There's a lot of that going on now, especially in this year, where a plan may have had a $10 premium, and now it's going to a $45 or $50 premium. That's a big change over the course of the year.
I'll tell you something. You've been doing this for how long?
Well, we've been doing this now since we've been doing Medicare since 1998. In 2006, Medicare introduced a product line called Medicare Advantage, so I've been doing that ever since the inception of Medicare Advantage. It's quite a complicated process, basically. And other programs that you and I have run together have differentiated those two types of products. Not enough time today to get into that. But to get into the importance of making a change, I've done several studies over the course of the last several weeks, and I'd like to tell you about a case I'm going out on as soon as we finish here, basically.
I do want to also tell you something about Howard, just really quickly. Howard is the most meticulous person I've ever met, and he really does, when he says if he researches, he really does. And when you get everything back from him, you have it spelled out completely, and why there might possibly need to change.
Surely. My case this morning was a lady who, if she did not roll over and if she did not switch her plan, and just rolled over her current plan, as opposed to the plan we are now going to, she would be spending $1,181 more next year than she needs to. Now, don't forget, it's the same pills from the same pharmacy going in the same stomach. So why pay more for it?
I agree with that.
In this case,
I love that.
Why pay $1,100 more for it? I'm going out on a case this afternoon where there's 3 people in the household, multi-generational household. Mom is 96, grandma I should say, is like 96 years old. She's not going to change her plan. Son-in-law, he's about 68 years old. He's not going to be changing his plan. But the daughter of this mother, this 96-year-old woman, she will be changing her plan. and her change is gonna be about a $400 change. For changing, because she is changing, she'll save $400 as opposed to simply rolling over her plan on a year-to-year basis. And here's the worst case that I've handled basically this year. I had a gentleman who took a drug, a new drug, and it wasn't on his original plan. It wasn't on his plan because it was a non-covered drug. If he had just simply rolled over his plan into next year, the difference between simply rolling over and where I am going to be placing this gentleman is $6,000.
Wow.
I mean, that is a real change. It's an extreme, it's an outlier, but there is serious money involved in these prescription drug plans. Now, we also review MAPDs, Medicare Advantage plans with prescription drugs. We reviewed them just as well. But there the emphasis changes not only on the drugs, but it also adds for the doctors, because we guarantee that your doctor is going to be on the plan going forward. When I say guaranteed, that was too strong a word. We try to make sure your doctor is going to be on the plan. He or she may be listed on the plan, but their contracts do not go on an annual year-to-annual year basis. So the doctor you start out with and go to January, February, March, and April, may not be on your plan in June. But that's something that's beyond our control.
He said it great. It's the same pill, the same pharmacy, and the same stomach. Why pay more? I love that. And I just say this, call Howard at 602-909-8433. That's 602-909-8433.
And the reason why you review your plan is so you don't have January surprises. That's what you don't want. You don't want to go and find out you're getting a pill for $5 and now it's costing you $50. That's something that's the surprise you don't want. You don't want to find out that your doctor has dropped out of plans when you present your card to the lady at the desk and she says, he's no longer here. You don't want that. That's a surprise that you can ill afford.
Again, it's a free service to you. Just call Howard at 602-909-8433.
Now, if you already have a broker, call him or her up and sit down and make sure you get this taken care of. If your broker's gone AWOL or no longer in the business, now has moved down to Florida or back to Bangor, whatever it is, just go ahead and give me a call, 602-909-8433.
Can people do this themselves?
Oh, absolutely. People can do it themselves, but you got to know what you don't know, and that's why you want to work with a broker, somebody who's done this time after time after time again.
And you have.
Many, many times.
Now, you got a white paper going on?
Oh, I always have white papers. If push comes to shove, I'll outline my methodology for you, and you can do it yourself.
Well, you know, what I love about you is the information that you give in such detail. You really do.
Well, that's important. You know, it's not...
You wouldn't think so, but it is.
Any broker can tell you your drugs are being covered, but realistically, at what cost? And at being covered at the lowest possible cost. Once again, repeating that old mantra, same pill, same stomach, same pharmacy.
I love that.
Why pay more?
And the best thing that you could do, first of all, because it's a free service to you, it just makes sense to have somebody do this review, and this year of all the years, it's very important.
Now, I did mention that Medicare supplement plans, you can actually review them anytime during a year, and you can move to make a change. The only reason you probably want to make a change is because of premium pricing, because the coverage is identical. A G plan from one carrier is identical to a G plan from another carrier. But what you really want to do is you want to make sure you're paying the lowest premium. Sometimes there's parity, there's premium disparity, okay? And you might want to go for the premium that has the lowest cost, and I can help you with that anytime during the course of the year. So keep that in mind just as well.
Just call Howard at 602-909-8433. You know, there's a lot of alphabets in the Medicare, but the one thing that does stay the same is the pills. They're either going to be the same pill, the same pharmacy, the same stomach, so why pay more?
And that's what we do. We help people make sure that they're maximizing this. Because, you know, inflation is upon us. It's been upon us. It actually perhaps influenced an election. And why pay more if you don't have to? Create your own whip inflation now strategy, and hey, maybe save yourself a little bit of money and spend it on Christmas gifts or the Christmas vacation.
Exactly. Well, here's the thing too. people, like you said it, people don't know what they don't know. And a lot of times, unfortunately, with one thing with seniors, you like to kind of keep the same thing. But that's not the case when it comes to these plans. With your medication, they change all the time.
So while we talk about change, let me tell you, about a third of the cases that I've done, there's been no change. People have just rolled over their plan, and that's fine too. But at least you have the confidence in knowing you made the right decision.
Well, we know a person very close to me that that had that situation where, he really probably wouldn't have done anything if I didn't say, hey, just call Howard, and what happened?
Well, I'm not going to discuss that with you because of confidentiality issues.
Well, I meant how much money did you save him, or at least it did have a change. You had a change.
We have a change, and he will be saving money.
And that's what's most important, especially to the seniors today. What are your final words? My
final words is review so you don't get surprises.
Go ahead.
I'll be more than happy to help you with your review, and it's a very simple process. We're running out of time, though. We have a December 7th deadline on this. That's imposed by the government. It's not my deadline. It's our deadline. Don't forget, I work for you. I don't work for the insurance companies. They pay me, but I work for you.
Just call Howard. His phone number is 602-909-8433. He is the most detailed person I've ever met, and what I love about him is he's giving you all that information. You make your own decisions on what you want to do, but because it's the same pill, the same pharmacy, the same stomach, why pay more? Just call Howard at 602-909-8433.